my home visits. So I'm here to support the launch of the Wedge of Health Freedom, as it is a plan to restore the private patient-physician relationship. It is beneficial both to the patient and the physician, and it allows freedom from third-party invasion. It is the choice I made 10 years ago that allows me to sleep better at night. As Sir William Osler once said, the good physician treats the disease, the great physician treats the patient who has the disease. Thank you.
Thank you, Dr. Arnett. That was great. Thank you to both of you. And I think what we see in these in these doctors' stories is where healthcare can go in the Wedge, what it can mean for a patient and a doctor to be back together again. I just want to say that there are other, what we see here are Wedge-like practices, and today is the first day that any practice can sign up to join the Wedge. And what we do know is that there are more than 400 direct primary care practices around the country, but we also know that they're pretty much invisible to the American public. So on our website, you'll see this description and what's there and what's over there to the side. You can see that it says today the Wedge is in there. It's in the circle of healthcare, but it's kind of invisible. So tomorrow we intend to make it visible, and we intend to make it bigger. And in the future, we intend it to grow and grow and grow until hopefully every patient and every doctor are back into a direct relationship with their, together with the patient and the doctor. So I also want to say that you may have heard of some of these practices, like Atlas MD from out of Kansas, or the Patmos Emergent Clinic, which is out of Tennessee. Patmos, Pay at the Moment of Service. And that's run by Dr. Berry. You may have heard of noinsurancesurgery.com. People come from all over the country and from Canada to get surgery done at a cash-based price in Nevada. And there's a surgery center of Oklahoma that puts all of their prices online and find that it can be as low as 80% lower than the hospital next door. So this is the way that we can bring affordable, patient-centered, privacy-focused practice back to between the patient and the doctor. And we have an outreach plan because we want everyone to experience this. We think this is the way healthcare should be, always was, and is the ethical way to do medicine without the intrusion of others making decisions, medical decisions. So our outreach plan is simple and it's grassroots focused. We have a website. The website is jointhewedge.com, and it is essentially a meeting place for doctors and patients to come together. So doctors who want to offer this kind of practice, which is, again, patient-friendly, pocketbook and price-friendly, and privacy-friendly, want to offer that to patients, and patients who want to find that at a very affordable price. So doctors only need to make a request to be listed, and all they have to do is say that they follow our 8 principles. Patients can come online and check out where are the doctors in their area that they can call up and visit. Then we are going to do patient engagement as part of our grassroots. So here's a card that is going to be available for patients to take to their doctors and ask them to join the Wedge. On the back are the Wedge principles, so they can write a little note to their doctor and say, you know, we would love to be willing to join with you to go into the Wedge and escape Obamacare, escape managed care, escape all the rationing that's coming now from Medicare. And in addition to that, we're going to do outreach to independent organizations of physicians and invite them to invite their doctors, their chiropractors, their dentists to come into the Wedge. And finally, we're going to also inform individuals, anybody who comes onto our website, we're going to inform them through updates so that they will know what's happening. So the Wedge of Health Freedom points the way back to health freedom, and it points the way back to the caring heart of healthcare, where the patients are really the purpose and the whole point of healthcare. So we invite all patients and all doctors to join the Wedge of Health Freedom and to break free together. Thank you so much. Are there any? Thank you. Are there any questions? for Dr. Eck or Dr. Arnett or myself.
I have a question for Dr. Arnett. You mentioned mostly third-party practices or interference is mostly
removing the middleman.
Yeah.
So the question was just about Dr. Arnett's comments about the middleman is mostly removed. So go ahead.
Instead of completely removed, yes.
And make sure that you're talking in the mic, just in case.
It's good.
Okay.
Yeah, unfortunately, we still do spend quite a bit of time prior authing medications and radiographical studies for our patients. 10 years ago when I was starting out, I would do some of my own prior auths, and it was, you got a person on the phone, and it was a little more, you didn't have to be so savvy with ICD-10 code, well at the time it was ICD-9 codes. And now, I mean, you literally cannot get anywhere without saying the actual number. You can't say a word that describes, like, my patient has abdominal pain, you can't say that. It's like, what's the code? Where they hang up on you. So it's a lot more difficult for a patient, I don't know how a patient could, honestly, prior auth their own CAT scan these days. So therefore, I do have to deal with the middleman, unfortunately.
Yes, to some extent, I'll just add here, to some extent you have to deal with middlemen as we transition to a much more direct relationship. I will just say, because I have not said in the comments so far, is that what we're looking for is a direct relationship between the patient and the doctor, and eventually with the patient and the hospital, and then the enrollee and their insurance company. 3 direct relationships, much like you have direct relationships with everything else that you purchase. Right. And so if more and more doctors are in direct relationship with their patients, there will be less and less involvement with the insurance companies.
That would be wonderful.
Any other questions?
I have just a comment. In the first place, I love the design of the wedge because you have to wedge these people and entities out of the way between the doctor and the patient. One thing that is happening, of course, you know this all too well, is hospitals are buying up practices, private practices, and they're consolidating their power. And then one of the most egregious things that I have had to deal with my mother's care has been hospitalist, because they take over the care. And I had a nurse tell me when my mother almost died this past year, hospitals no longer are about curing people, they're about getting them to a maintenance level and getting them home. And a lot of patients don't have the ability, have the support systems to be able to maintain their health without their doctors, their primary doctors involved. And if their primary doctors do not have the giving privileges and the hospitalist takes over the care, it is detrimental to the point of death.
So the comment for the, so that people who might not hear your comment, is basically about the difficulty with hospitalists who are actually the employees of the hospital, and when the doctors do not have privileges at the hospital. And that's, of course, one thing that we would like to make sure that doctors do have, so that they are continuing to direct the practice. And I know that Dr. Eck does visit hospital. Would you like to say something about that?
Sure. I can definitely attest to that. Being the primary care doctor and not being beholden to the hospital administration, I can do what's best for the patient. And I don't have to worry that I might lose my job if I do too much for a patient, because honestly that is what's starting to happen. If we prescribe expensive care or expensive testing, the hospital will come down on the doctor that does that. So the hospital can't fire me. And that way, I mean, there's other ways that they can get rid of doctors, that's a whole other story. But so far I've been able to stay and to be there and advocate for my patient, which is really the reason why I became a doctor.
Absolutely. Thank you for your work.
I will say, and you can see it in, let me see, here we go. And these diagrams are on our website as well, just so that you know. But here is this direct relationship between the doctor and between the patient and the doctor. But there's also a direct relationship here between the patient and the hospital. And so in the future, we actually envision wedge hospitals. Hospitals that are also free of the regulatory structure, hospitals that are free of managed care, hospitals that actually want to do the most and best for patients, because that becomes their customer as compared to, you know, the government or the managed care organizations or whomever. So right now, we start with wedge practices, but we are looking forward to a future where that circle, where we said the yellow circle where it says the future, that also includes hospitals.
Certificate of need laws have to be addressed with that.
Sure.
And I think the wedge will help with that because as more and more individuals, voters, get involved with that, that's how you leverage
This is,
politically out of the way. It's a brilliant idea.
well, thank you for saying it's a brilliant idea. That's a wonderful thing to hear, and I just want to say this is the beginning. This is the beginning of going back to the future in healthcare, back to freedom.
One more thing, I can just say that the Affordable Care Act might be actually promoting the idea of the wedge, as a lot of people have deductibles that are very, very high. And so they might find that going to a user-friendly, price-friendly practice is the best way to get the best care, as long as you're under that deductible anyway. Why go to a doctor in some network? So we are finding that our practice has gotten busier since the Affordable Care Act, which we take none of that insurance.
Yes.
And that has to do with my question. The patients, are they, what is the response of the patients? If we have 402 or so practices, how many patients are involved, and are patients realizing what you just said, that the Affordable Care Act, that the deductibles are higher? Do they realize that this can be a much more affordable and pocketbook friendly way to?
Yeah, we're doing our best to let them know.
So the answer to the question is, do patients realize that there are direct primary care practices already? As I said, our whole plan is to make the invisible visible. So while this is happening, and these pockets of patients and doctors are already interacting freely, we do not believe that most of the population even knows that they exist. And so, but we do know that a lot of the primary care practices are looking at somewhere between 450 to 600 patients for each doctor, rather than the 2,000 or 3,000 in some other kind of practices. Do either of you care to say something about that?
I have 400, and over 50% of my patients are Medicare patients.
So you have 50% of your Medicare patients who are paying you cash.
Yes, to come see me.
And that in itself is a statement, I believe. Do they say why?
Yeah, they can't get good care anywhere else. They really do tell me that.
Okay.
And they're not being reimbursed by the Medicare system.
Not at all, not a dime. And they have to sign, every 2 years, a lengthy contract with me that they are aware they cannot, get money for Medicare. So I think it's painful for them, but they like it. They do it because it's that good.
That's wonderful to hear. And I think, what people don't understand is there's 10,000 people joining Medicare every day. 10,000 people joining Medicare. Medicare has a $43 trillion unfunded liability. If you are a Medicare patient, you're actually in trouble, and you don't realize how significantly the rationing is coming. And already we have Medicare patients before we are anywhere close to where it's going to peak. Already we have Medicare patients who are coming to you and paying cash because they feel like they can't get the care they need elsewhere. So that's a statement of where we're going, and a reason for the wedge and for the restoration of the patient-doctor relationship and the wedge practices.
Fewer and fewer doctors are taking Medicare and Medicaid patients. So just because you have an insurance card from the exchange doesn't mean you have a doctor. It means you have some sort of partial coverage, but it doesn't mean you can find a physician.
This is true. The comment was that we do not, just because there is a card and somebody has a card, an insurance card, that doesn't mean that they have access to care. And we have often said in our organization that coverage does not equal care. Coverage is just a piece of paper that promises certain things but guarantees nothing. And so sometimes when you really have need of care, you find out how little you have in your coverage. Any more questions? All right. Thank you so much for coming.
Thank you.